Hello, my name is Dr. Kenneth Tomkovich, and I'd like to welcome you to my institute here in central New Jersey in the United States of America. We're in Freehold, New Jersey tonight at Central State Medical Center, where I'm the medical director of breast imaging and interventions, as well as here in the Freehold Radiology office on the campus of Central State. I've been here for approximately 15 years. My background is in interventional radiology, and I trained with Dr. David Cumpy at the University of Colorado in Denver. Tonight we're going to be talking about breast biopsy procedures, predominantly the ultrasound-guided Cassi biopsy procedure. The biopsy gun is reusable, but it requires other components that are single-use devices. A single-use CO2 cartridge, a single-use biopsy needle, and a single-use biopsy tray to obtain the samples. It's very easy to assemble the Cassi biopsy gun. First, a CO2 cartridge is inserted. When screwing in the CO2, you may feel a slight puncturing of the CO2 cartridge. The CO2 cartridge should be squeezed into a final locking position within the biopsy gun. Next, the biopsy needle is inserted into the biopsy gun and also screwed into position. It's important to make sure that the biopsy needle is screwed tightly into place. It is important to pre-fire the device outside of the body before performing the procedure to make sure that it is functioning correctly. This is accomplished by pressing the sample button, which starts the CO2 cycle. During the pre-fire cycle, it is important to observe the 19-gauge tip, which actually freezes during this cycle. You can see frost form on the needle, and sometimes you will see a wisp of white smoke or frost material come from the tip of the needle. Once the cutter passes over the 19-gauge needle, we know that the cycle is complete, and we press the retract button to withdraw the cutting needle. The sample, which is a single-use needle, is easily delivered in a single-use sterile biopsy tray by placing the needle over the tray and withdrawing the sample, or placing the needle in this notch and withdrawing it to deliver it into a formalin cup. To disassemble the device after use is quite simple. One presses the on-off button and holds it for approximately 3 seconds so that the green light goes off. The CO2 cartridge is unscrewed, but should be done slowly as gases will escape during this process. The biopsy needle is then unscrewed from the biopsy gun. Again, the CO2 cartridge and the biopsy needle are single-use devices which should not be reused in patients. The Cassi biopsy gun is reusable. The Cassi biopsy needle and biopsy device is a particularly useful device for my everyday practice. I have done over 500 procedures with the Cassi needle, and I am very happy with its performance in all of my patients. Quite frequently, the patients don't even feel this biopsy procedure after administering local anesthetic. Most of the time, the biopsy patients are very happy with the biopsy device and its features and results. I can honestly say that the Cassi biopsy needle is part of my everyday practice. It is a very useful device, particularly in tough areas such as very dense breasts, lesions near the chest wall, and lesions near the axilla. It is also quite useful to identify vessels with this device, which can be avoided by targeting away from the vessels during a biopsy procedure. This cannot be done with a vacuum-assisted device, which randomly pulls in and samples the surrounding tissue with the vacuum and its cutter. In summary, the Cassi needle is a very useful device and one which is very good for patients and good for obtaining samples in ultrasound guided breast procedures.